Look, we get it.
None of us are excited about wearing a mask.
Or social distancing.
We want to hang out and high five.
We've done a great job of masking up.
Keep it up and keep the physical distancing.
And here's the tough one.
We need to keep our gatherings small.
To no more than 5 people outside our homes.
If we're to stop the spread of COVID-19
And open up our schools and enjoy more in our community.
Gather responsibly this Labor Day weekend.
So let's do this so we can get back to the high fives, the hangouts, and the uncovered faces.
Visit bfhd.wa.gov to learn more. Getting tested for COVID-19 can help open up our community while protecting you and those you care about. Free. Yes, I said free. Free. Drive-through testing is available at the HAPO Center in Pasco every Tuesday through Saturday, 7 a.m. to 1 p.m. No appointment necessary. Anyone who has COVID-19 symptoms, may have been exposed to COVID, or is simply concerned about their COVID status should come get tested. Additional information and testing sites can be found at bfhd.wa.gov.
Cities. It's 9 o'clock on Wednesday instead of Friday today. We are live with Coffee with Karl. And sorry, we might have had some technical difficulties. I was doing the screen sharing on our lead-in, which was new for me, and I probably messed something up. I don't know if everybody could hear the videos. Those are some great videos that have been put together to kind of highlight some of the things that are going on with the Tri-Cities, and that's our topic for today. We are happy to welcome back Dr. Amy Person, the Benton-Franklin Health District Health Officer. Good morning, Dr. Amy.
Good morning.
Excuse me, Dr. Person. I know I'm trying to be Dr. Person as your title, and I'll try to use that. I know I've heard other people refer you to as Dr. Amy, so I'm going with Dr. Person. Good morning.
Morning. And I answer to almost anything.
I know that you do, and you're very, very kind. But you know, you are really a trusted official, and I want to make sure that, and as everybody's going through some hard times, you're doing a great job. I just want to make sure that I'd like to call you Dr. Person. Thank you.
Thank you.
Also, welcome back, Jason Zaccaria. Jason is the District Administrator for Benton-Franklin Health District. Good morning, Jason. Oops, you're still muted, Jason.
There we go. Sorry about that.
No worries.
Good morning, Karl. Thanks for having us this morning.
You bet. No, it's you guys always have great information and good discussion. It's great to have you back, and especially on a Wednesday to make up for the long weekend. We wanted to get this out of the way before we go into that. And then the first time on Coffee with Karl, Nurse Heather Hill, who is the CD supervisor, and I just learned this morning that CD in health district terms means communicable disease supervisor. So welcome, Heather.
Thank you. Glad to be here.
You bet. Looking forward to a good discussion. So you guys know we always start off with a coffee discussion. This morning, I can't remember if I used this one before, but it's actually my wife's coffee mug. Her name's Tiffany, so this is her mug. And I just wanted to pay tribute to her because we started school yesterday with our kids. We have 2 kids in middle school and did online school. I think everything went great. She is such a good mom, and she was there for our kids. We're very blessed to be able to do that. Not every family has that opportunity to have one of their parents that can help with the kids in school. So I just wanted to give a shout out to my wife, Tiffany, this morning with my coffee cup. So let's go to Dr. Person next and see what she's, if she has a mug or coffee story this morning.
All right, I'm trying to figure out where to put my mug.
There you go.
Okay, so yes. So this is my bug cup, you know, because I do like to pay attention to all things around me, including the things some people don't find that appealing. So not just the little cuddly things, but also the bugs, the snakes, all those things, all very important in our giant interdependent ecosystem. So this is my shout out to bugs.
I like it. Do you have a favorite bug you want to give a special shout out to?
You know, I try to be for all bugs, you know, so okay. I don't want to alienate a species that probably has a billion participants.
I like that. That's a good answer. Thank you. Jason, how about you? What are you drinking this morning, or your cup mug story?
Oh, you know, I wish I had as great a story as Dr. Person did, but I'll try and get this in the camera. So this is a trusty blue Target cup. It is fairly utilitarian. It keeps things warm for at least 6 hours. You can tip it without spilling. Notice I did actually shut my lid before I did that. Double check just to make sure. Other than that, it's just black coffee to get the morning going.
Great. Thanks, Jason. And Heather, how about you? Do you have a coffee or mug story this morning?
Hey, with me this morning, I have downtown Shanghai, China. This mug is from the largest Starbucks roastery in the world, which is in Shanghai, China, where I tried some beer-infused coffee for the first time and not a fan. I am not going to be drinking beer-infused coffee in the morning. Not to worry.
I'm trying to taste that, and I don't know if I can even make my brain work that way. I have had
very unique
coffee-infused beer, and I know what that tastes like, but
yeah.
Beer-infused coffee, that's, yeah, never heard of that. Wow. Is it popular in China?
I believe more popular there than here at this point.
Perfect answer. Thank you. Well,
or
let's
maybe
get
it was
right in.
just for the tourists. I don't know.
There you go. Hopefully they weren't feeding the tourists what they didn't prefer themselves. So.
Yeah.
Well, let's get right into it. I think, our topic today is, especially going into the long Labor Day weekend, we wanted to make sure that we left with some good positive messaging from the health district, and then also recommendations for, how we should go forward with our behaviors to make sure that we are staying safe and that we continue to drive the rates down. But Dr. Person, do you want to start off with just giving us an overview of how are we doing? I think that's been our topic in past Coffee with Karl's, but how are things going? What are the trends showing, and how are things in general at the health district and in Benton-Franklin counties?
Sure, I'm happy to start, particularly when I can start with good news. Our trends in Benton and Franklin counties are really impressive, I will say. We have kind of cleared our peak and are progressing downward at a very lovely rate, I will say. Benton County now down under 130 cases per 100,000 per 14 days, and Franklin County is now down below 300. We look at the cases per 100,000 over 14 days because that gives us really the best measure of active disease in our community. So I think we have made significant progress, and that's not just because of the work we've done at the health district, but really is testimony to the work that I'll say 300,000 people in Benton and Franklin counties have been doing, wearing their masks, not just at work or at the grocery stores, but anytime they're outside of their home, trying to limit their gatherings, so no more than 5 people outside of their home, staying home when they're sick, maintaining that social distance. So they're all new habits, a little harder to get used to, but I think that's really how we are taking control of COVID-19, which, for a long time really took control of us. And I think it's important to remember that unlike, when you're bike riding and you're working hard to get up that hill, and then you just coast downward, our progress downward, it's not, we're not coasting. This is really all us continuing to work. And it's a reminder that if we stop doing those things, I think we are gonna head back up. But we're really, our big focus, or one of them now, besides getting more of our businesses open, is, as you alluded to, working to get kids back into school, because I know that's really been a challenge for our families and our community.
You bet. Jason, anything else to add to Dr. Person's, talk about the trend and some things that are going on, or any reflections on how are things going?
Yeah, sure, Karl. I think, one of the things that has really made a difference here over the last 3 weeks or so is that we really want to thank our community, as though they've really been making a big difference in terms of doing all of those things that Dr. Person has been discussing with us all now for quite some time. Most of the community is listening. And also, really, I think we need to give a big shout out to the advocacy of all of our community leaders. Folks have really been pulling together, getting the messaging out in a number of different ways, actually many, many different ways. In fact, this is one of them right here. And so I think, that level of awareness that we need to get instilled into our public is really starting to happen. We're realizing that difference. And that is shown in evidence, in hardcore evidence, given the trend lines that we're seeing and the other statistics and metrics that the Department of Health wants us to hit.
Oh, that's great. I always forget about it when we start, but I wanted to encourage our audience members, if they have any questions, we'll be using the question and answer feature at the bottom of the screen in Zoom if you're on the Zoom call. If you're on Facebook Live, you can put your questions in the comment section, and then we'll go through those questions as we get them a little bit later on. But if you do have a question, use those features. Well, Heather, this being the first time on our show, do you want to talk a little bit about what you do as the communicable disease supervisor, like in normal times, and then how's that shifted with COVID? And then if you want to share anything with us on kind of how's it going, and do you have any attribution for these trend lines? Like, are there some, beyond what we've talked about, some things going on that you want to highlight?
Absolutely. In normal life, our job in the communicable disease program is to watch for disease trends. The basics of what we do is surveillance. We're watching for disease trends, what's arriving, and then we do investigations. There are certain diseases that we are mandated to talk to people about and find out how they caught it, and our ultimate goal is to mitigate the spread. So doing COVID investigations is just on steroids what we typically do in regular life in the communicable disease program. And I've been with the health district over 37 years now, and the majority of my time is with communicable diseases. We train for events like this. We have tabletops. We work with our community partners on planning for a pandemic or a significant event like this. But I must say that the last 6-7 months has been unlike anything else I've experienced in the world of public health. And I think we need to understand that we're really writing the book. There was no COVID game plan. There was no recipe on how to move into COVID. And we're writing the book as we go, and we've learned a lot of lessons. And so as the community, and I think that's what we need to look toward, is the fact that we didn't know what to expect, trying to message the community and help the community get on board with mitigation plans. It was new to all of us. We were all in this together. And like Dr. Persons said, it's really exciting to see that I think Tri-Cities is finally getting in the groove, doing what needs to be done, because all of us want to continue to progress to life as normal. But we also realize that we're going to be entering a new life as normal, because COVID isn't going away. It's not an on-off switch. Many of our diseases tend to be an on-off switch that we deal with, but with COVID, this is going to be a dial down, not on-off switch. So I think we'll be continuing a lot of our mitigation messages for months to come.
Can you talk a little bit more about that, Heather, on-off switch versus a dial down? I mean, like in normal outbreaks, maybe that you'd track in communicable diseases, how do they perform as an on-off switch? I mean, if there was a hepatitis outbreak or something, is that an example of an on-off switch, or would like a normal flu season be an on-off switch?
Probably flu and COVID tend to be similar, where there's a dialing down of the number of cases we see. But if we're looking at, say, a Legionella outbreak or a Salmonella outbreak, that is a point source. Once that vector or that reason for the infection is gone, we're done. But with COVID, just like with influenza, it tends to go on and on and on. And we just slowly start to see a decreasing rate. And especially the more people continue to do what needs to be done, we'll continue to see that curve go down.
Yeah. Oh, that's great. I can't remember if we talked about it before. I just remember when I went to college a very long time ago, because of the last pandemic that we had, the flu in 1918, 1919, living in a dormitory style housing, the local health code was that you had to keep the windows open at night. You know, it was almost like a bunkhouse, barracks kind of situation. So, you know, in the wintertime, like snow would be coming in, but you'd have to keep the windows open. And now I think coming full circle with the latest that we're learning about COVID as an example, that, you know, there is airflow is a very important factor in that. And Dr. Person, do you want to talk about that a little bit? To Heather's point, this is so new. We're learning about how it spreads and what are the best practices. But could you just give us maybe a little update on what are we learning as far as, you know, what should we be doing in each of our lives, or what should we be considering as, you know, we do go out into like, say, go to a store or, you know, something like that. Is any changes in that, or is it still pretty much still the same guidance?
You know, much of our guidance hasn't changed, but we are learning some specifics. You know, initially there was concern that COVID-19 might be spread as much by fomites, so, you know, those particles that are left on surfaces, as well as droplets. So, you know, what comes out of our mouth and nose when we talk, breathe, or sing. What we're seeing at this point is that it looks like the fomites, the surface things, do not play as large of a role. So while we don't need to be quite as worried necessarily about, you know, bleaching every package we receive in the mail, or bleaching all of our fruit from the grocery store, we need to pay attention to who are we in close contact with. I mean, I think that's really going to be the key. Some of the things we continue to learn about it is that there may be this concept of the super spreader, right? So not everybody who has COVID-19 is necessarily going to infect everybody the same way. There do seem to be people who can spread it much more widely. Super spreaders do seem to be people who are younger. They may not have symptoms, and they seem to be better able to create very small droplets, more like aerosols. The challenge, of course, with COVID, as with most viruses, is that the super spreaders, you know, don't have the big S on their cape to say, you know, they're the ones to avoid, and that's why we still need everybody keeping distance from one another. You know, and the other thing that I do want to say that I think we've noticed at the health district in terms of some of the other communicable diseases that we do follow, that we do monitor, is that all of these steps we're taking to keep from spreading COVID-19, many of them are also working to reduce our spread of other diseases. So while we're learning as we're going along, the tools that we're using are tools that public health has used for decades and probably even centuries. So, you know, disease investigation, reducing spread of droplets through wearing masks, keeping distance, staying home when you're sick, or staying in quarantine when you've been a close contact. Those are all things that have worked since the 1918 pandemic, and probably even before.
You bet. Jason, what do you, how are things going to kind of stay on this trend line and things are getting better? And we've talked on past shows about the role of the health district and, you know, the contact tracing and all the other functions that you're doing along with testing and working with different testing locations. But can you kind of give us an update on how are things going overall at the health district? And are you, you know, with an improving numbers trend line, are you shifting people around or having a different emphasis within the department, or how's it going?
Yeah, sure. So, Karl, I think a couple things. One, we'll just be honest, we're tired, right?
Yeah.
You know, and not to be all negative or anything, but we've been at this now for well over 200 days, and you know, it's been a challenge for us, particularly with our staffing. We wish we had literally double or triple the staffing and or resources to bring those staff aboard. But to answer your question, yes, we have been shifting people around depending on what our area of focus is for the day or the week in terms of our plans. For our IAP, we do shuffle staff around depending on where the need is. And we stand up different teams under the incident command structure to make that work. And yeah, I think it's been going reasonably well, particularly with our new contact tracers now working out of the Benton County Fairgrounds. We're very thankful to our elected officials for making that a reality for us. Plenty of room to spread our staff out, concentrated area for staff to work, which is good rather than being far, far away. The other piece that we should mention too is that having these contact tracers that are local individuals with continuity day after day, week after week, we feel will be a really big boon for us going forward in terms of bringing that trend line further down so that we can get our kids back in class at least to some degree, hopefully sometime this fall. So we've been very, very busy over here. At the same time, we're very excited that we've been doing such good work with our community partners, our elected officials, our Board of Health, Visit Tri-Cities. We've just been doing all a really fantastic job on that. So we're excited at the same time. So we can bring that trend down, Karl, the better off we're going to be.
You bet. And I would be remiss if I didn't give a shout out to Visit Tri-Cities. Sorry, Michael, that I didn't have the sound on for the videos for that, but they're such great videos. Those PSAs that you guys worked with Visit Tri-Cities to produce are such good messages. We will play them at the end and the sound will work, but wanted to give a shout out for that because I think that's been a great way to, you know, as we've all partnered together, Visit Tri-Cities have been a leader in producing some of these videos that just, you know, help get that message out and get the frequency up so that we can all share in that message. So Heather, with your role at the health district, is contact tracing one of the things that you're involved in or supervising that area?
I was fortunate enough to spend the first week with our contact tracing team and help do the training. And like Dr. Person said, contact tracing is one of the tools in the toolkit of communicable disease investigation that we've used throughout history. It is one of the most important ways to mitigate, to stop the spread of a disease is through contact tracing. And we realized very early in this pandemic that we didn't have enough staff to do an adequate job of contact tracing. And we turned it over to our Department of Health to do that while we were able to get some staff on board, get the training done, and then we took it back a couple of weeks ago. And we have right now about 19 staff out there doing the contact tracing. And I think what impressed me about this group of people is when we asked each of them, why did you choose to take this job? And hands down, we kept hearing, because this is very serious in our community and I want to personally do something to make it better. And this is one way I think I can make a difference in our community. And so my role was to help train them, and my continuing role is to be the subject matter expert, help answer questions, because these are lay people. They're not medical people. Sure. And so they've had a pretty steep learning curve, not only about what COVID is, but how it's transmitted all the way to how do you test for it? Because when they do a contact tracing call, they are seen as the expert by the person that they're calling. We've heard some really good stories. I think my favorite story that came out of one of the calls was our contact tracer was talking to a gentleman And it became very obvious that the wife was in the background listening on. You know, who are you talking to? Why are you talking so long? And finally the husband said, wait a minute, I am doing very important business to protect our community. Let me talk. It was one of those really moments that we shared with all of the contact tracing team, because they are finding that community members really do want to participate, want to help, and are willing to communicate with our contact tracers. But with that said, I think it's also important to get a message out that there have been some unfortunate situations where people are using this for not the best things, fraud and whatnot. So make sure that our community knows that a contact tracer is never going to ask for a credit card, your social security number, those risky pieces of information. Our job is to find out who you've been with, and so that we can then have a conversation with that person about their potential risk. All the information is confidential. We don't pass names around. I've heard some anecdotal stories that people posing as contact tracers have said, give me your credit card number and I'll send you a test kit. And that's absolutely false information. And if that is happening, that's not one of our contact tracers. That's a person who's doing fraudulent work.
That's great. I'm glad you shared that story. And I can't, you know, what you both said with you and Jason, that, you know, you've got local people that are concerned about the community, and that's why they're stepping up to do this. I think that that's got to be such a better situation when you're sick, you get that call. I'll bet that helps a lot, you know, versus somebody out of state. Even I'm sure people that have COVID have a lot of questions. There's probably a lot of fear and they're scared.
And
so I'm sure that
we've seen that our contact tracers that know the community actually are getting better information, and we've been on top of a couple of outbreaks much quicker than we would have been. And then our contact tracers also feed information to our care team, because we know that some people don't have the resources. If we're telling them you must stay at home and quarantine, how do they get groceries? How do they get their prescriptions? And we do have a care team that is available to help people get those resources that they need.
That's great. I think that, you know, to tell these stories just helps all of us understand where we're at. And I think, you know, again, me being new to the community, I think it's really very impressive of our whole community that it feels like we've really come together. And I think, Dr. Person, you mentioned that when you talked about using the right behaviors, and now we're seeing the effects of that in our trend line, that, you know, it's really paying off. And I think it's really a great reflection on our community. We got one question, but let's go back to, I think you mentioned it, Dr. Person, schools. And, you know, obviously we started school this week. And can you give us an idea of maybe going back to the trend line? I think you had a mark on there. That are there some key metrics that might be in the future, assuming that we hit them, a time where it would be, you know, that there would be a chance to have in-person school? Or you want to talk about that a little bit?
Sure, absolutely. So we're following the guidelines that the State Department of Health issued, and they developed those guidelines really by looking at places not just around the country, but around the world that were able to successfully get kids back in school without, you know, creating huge spikes in cases. So the number that they landed on after looking at what worked is 75 cases per 100,000 over a 14-day period. So you can see by the graph that's on the screen now, Benton County is really approaching that very nicely. Franklin County, I think, is a little farther to go, but that's a little bit because they're kind of coming off of a steeper peak. So I think, again, if we can keep doing what we have been doing, so we're not coasting or resting on our laurels, so to speak, but really still putting in that work, I do think it's realistic to expect to see kids back in school this fall. You know, what we're seeing now this time when most schools are doing distance learning, except for perhaps some of the higher educationally at-risk students or some of our smaller private schools who have been able to have some kids back in the classrooms, is going to be to use this time to ensure that we are ready. So if cases do occur in schools, in classrooms, we can identify those early, see who may need to be quarantined, so that we can make in-person schooling as non-disruptive as possible. Because if we have kids going, you know, in the school, out of school, in school, out of school, I think that's not going to help either. And that's the experience that some states did see when they sort of tried to rush into getting lots of kids back in school. You know, I think one of the challenges has been that COVID-19, at least early on, did really seem like it was sparing kids. We weren't seeing a lot of cases in kids, but we have seen that as more kids are spending time together, whether just, you know, in small gatherings or, you know, some of our older kids in their practices or at college level, is that kids can get COVID. Most of them don't get as sick as adults, but those ones that do get sick are ending up in hospitals and ICUs as often as adults are. So, you know, that's why we don't just want to say COVID's no big deal for kids. Let's just, you know, put them all back in school and not worry if they get COVID, because, you know, they've got a lot of years to have a hopefully long and happy life, and we want to make sure that that's going to happen. Oh, Karl, I think you're still muted. Oh.
Sorry, we all have to do it at least once on every Zoom call, right? Thank you. I just read an article this morning. I think WSU, while they're doing online schools on the main campus in Pullman, they, you know, a lot of students are coming back and they're doing their remote learning from their dorm room or wherever, I think, but they are seeing a spike in cases that is attributed to, you know, younger people. And I think I recall early on when we first started on a conference call, I think with Association of Western Businesses, and the one of the education leaders for the state was on, and they were talking about that with schools, one of their big concerns was a lot of the folks that work in schools, and, you know, just their demographics, that, to your point, and we continue to learn more about it, about ages and you know, how sick do they get, or how hard does it affect students and younger people. But because so many other people working in school, from the lunchroom to the bus drivers to parapros and all the great people who work in schools, they might be at a higher risk. And so we don't want to, you know, get into that in the wrong situation. As you look forward to hitting some of these targets and maybe going back to in-person school, would it be like in a normal classroom setting, or would we need to increase the spaces and social distancing? Dr. Persons, is that still kind of being worked on, or that future plan someday still out there?
Yes, so the school districts, you know, we've been working very closely with them, and they've been great too. So those plans are already in place. So, you know, again, as Heather mentioned, we're moving back towards a normal, but it's going to be a different normal. So when we talk about kids back in classrooms, the classrooms are not going to look like they looked like a year ago. So we are going to be needing to maintain that physical distance. Students, staff, they're going to need to be wearing masks because, of course, you know, I get a lot of questions. How come we can't open schools, but we can, you know, have retail open, or we can even allow some in-person dining. And a lot of it, again, it's really scale. It's, you know, how many thousands of students are we talking about, and how long are people spending in school together?
Yeah.
You know, I think that's the challenge. Most of us don't go to a restaurant, you know, for 6-8 hours. We're not in a store for 6 to 8 hours, unless we have some kind of, perhaps, you know, obsessive spending penchant. But you know, that might help. But yeah, you know, we do know, I think, that this has been a huge challenge. But I think we've also, again, seen not just individuals in our community, but, you know, as Jason mentioned, our community leaders. I mean, you know, you mentioned Visit Tri-Cities, but, you know, I'll also give a shout out to you and TRIDEC, right? Because, you know, if we're talking about asking businesses to look at how they're operating so they can operate safely, you know, at the health district, we're not business people. So, you know, having expertise from people who understand that community and can talk to us about how do we, you know, how do we move forward in a way that keeps us safe from disease, but also allows us to find again, you know, our economic health, right? Our economic and our social health. Because when we're talking about keeping the community safe, it's not just we need, you know, no COVID-19 cases. Because if we wanted that, we would say everybody, you know, has to stay locked in their home for a year. But yeah, that'd be great. There'd be no COVID, but we'd lose so much. So we don't want that. And we are seeing some new studies coming out that have really are tying how we manage COVID with economic recovery as well. And it's not, what we're seeing actually isn't the obvious thing, because again, I hear a lot, you know, we've done all these things to try to reduce the spread of disease, and it's really hurt our economy. So if we had just let everybody do what they wanted, you know, we might have more COVID, but our economy would be okay. And if we look across the globe, countries that have suffered high rates of disease and high rates of death due to COVID are also the ones that have struggled economically. So I think those two things do go together. When we can help communities manage the infection well, we are also at the same time helping them to on that path to economic recovery, because you can't function economically if your workforce is all sick, or if your patrons are afraid to come back in because they're afraid about getting sick as well. And that's where, you know, TRIDEC, Visit Tri-Cities, the Tri-Cities Chamber of Commerce, I mean, they have all stepped up 150%, you know, to say, what can we do? How can we help maybe bridge that communication gap between, you know, those of us that like to talk data geek and public health, and those of you who talk, you know, this is what, these are the numbers that business likes to know, or this is the language that business can understand.
You bet. Well, thanks, Dr. Person. I think that was great. You know, we were all excited to help out with the Tri-Cities Open and Safe coalition that we all came together on. And I think it was a great recognition of the teamwork that we all had, that, you know, when we got to that first step in modified phase 1, that it was a requirement for businesses that, you know, under the new guidelines could open, that they needed to sign the pledge and then turn in their plan to the counties. But I think that's a great story. And Jason, you want to talk a little bit about, it kind of corresponds to one of the questions we have, but as there's been progress, as our numbers have come down, and then through Department of Health and through the health district, there's been an opening and changing in some of the businesses that could open. We have a question about, you know, different types of gymnastics facilities, modified phase 1s, that some can open and some can't. I think this question was around gymnastics versus dance studios, but I'll talk a little bit about what the health district and then some of our local elected officials have been working on, and really, I think a weekly at least, and more than that probably, with Department of Health in Olympia, to try to open more businesses and do it in a safe manner, as Dr. Person described, you know, that we can have some confidence that we'll go into these businesses, be safe, you know, do the best thing we can for them. Can you talk about that a little bit?
Yeah, sure, Karl. So I think Dr. Person really hit the nail on the head. It's if one of the analogies people can use is thinking about COVID as a fulcrum along with our economic status. People need money, people need to have a roof over their head. There's a fulcrum somewhere there in the middle-ish where we need to balance what is safe and healthy, relatively healthy and safe for us to open to the next thing that we may open. One of the biggest pieces that we obviously got this last go around was the indoor dining at a limited percentage, but I think that made a really, really big difference, at least in the hearts and minds of our citizens, as well as hopefully their wallets and pocketbooks at the same time. So when we go and we work with our elected officials and our other community leaders on our several times a week call, we have discussion about what do we think we might be able to open next that would be safe, minimize that risk where there is social distancing, where there is mask usage, where there is hand washing, where perhaps it's only smaller families that get together, i.e. coming into indoor eating, for example, limiting the time frames for which people may be together. Coming off that long discussion about schools, you don't want to be situated in a location where it's not family members, perhaps unknown individuals where you're close by or relatively close by for a very long period of time. Actually, it goes all the way back to your example early on, Karl, of opening up the windows at night, right? Kind of made me wonder, was that to get rid of the beer smell, or was that for COVID purposes, back then, or were you just practicing, or what? But
no comment.
All kidding aside, though, really to answer your question, we do sit down and we talk about these things. What would make a difference for our community? One of the biggest things in this whole process is to remain vigilant about hope, right? We will get back to some level of normalcy. It's just a matter of time. And it may be a little different at some point in the future than what we've been used to. But getting these services and businesses open has been one of our key priorities. We talk about that just as much as we do about how prevalent could this disease become if we do open something a little too early. And I think we've seen that across the country in various examples where agencies have opened up early without giving careful thought to that fulcrum and where are you on that plane, so to speak, of safety versus we need to get this service open. So we will continue to have these discussions with our electeds and our Board of Health and our other community leaders, Visit Tri-Cities, the chambers. They've all just been so thoughtful and willing to bring resources to bear on the problem. It's just been absolutely fantastic. So again, I'll just put in another plug. We're all in it together, and we could not do it alone, that's for sure.
You bet. Thanks, Jason. Well, we really appreciate the collective effort of everybody, working on this, because as we said, this is critically important that we open the businesses. But I think, again, just reflecting on our community, very strong commitment to safety first. Let's do this safely. And even I'll tell a story. Last week, I was waiting in line to get a Chromebook with my son to get ready for school this week. And we were standing in line, socially distanced with masks next to a gentleman. And he shared with us that he worked at Lamb Weston over in Pasco. And, but he made a comment why, that basically the things that we're doing, social distancing, getting ready for doing school remotely, wearing masks, are to help our community members and keep people safe. And I thought, like, this is just a random occurrence. We're having a conversation because we're waiting in line here, and this guy's sharing this with me. That's a good reflection of everything that everyone's been doing. And you can hear that message back. I think it's just a really strong indicator of our community that these messages are working. Obviously, we see the numbers coming down, and I think it's really good feedback for all of us. But Heather, I just had a question for you about in contact tracing and in the communicable disease world. What are some things that maybe going into the long weekend now that maybe we're seeing on how is the disease spreading here locally, that we would like to just reinforce, like, don't do this, because we've seen it happen and we can confirm it's happened through contact tracing. Can you give us some tips on that or some things you can share with us?
Sure. This is typically Labor Day weekend is the end of the summer and the beginning of kids going to school and our life changing into the fall winter months. And it tends to be the last hurrah of events with family, picnics, hiking, camping. We're really excited to have the air show coming in this weekend. But I think a really strong message that we need to keep remembering is continue to do all those things that have been working. Wear your masks, social distance, hand wash, all those things that we have been promoting throughout this pandemic are even more important. Do not let our guard down. All of our goal is to get our communities opened up again. But it takes that individual person making the commitment to do what needs to happen in order to see disease trends change. And this is a weekend that's kind of critical for us. And how we conduct our lives as a community is going to make the difference of how we head into the fall months. So don't blow it. Don't blow it, people. This is not the weekend to blow it. We talk a lot with individuals about how to move a little more into socializing. And we talk a lot about pods. And you create your safety pod, your pod of people. And we hear oftentimes 5 people. Who are your 5 people that you can negotiate how you're going to commit to each other to keep that pod safe? So an example, at the air show this weekend, they're very specific about how many people to have in the car. They must be household members and stay with your vehicle. Don't wander through the park. We want people to stay in the safety net of that pond where everybody's committed to doing exactly the same thing so that the disease doesn't enter that pod. And we'll probably be talking more and more about pod safety as we progress to being able to open more things in our community.
That's a good point. I think, again, this morning I just read an article about Mark Few, the Gonzaga basketball coach, who was talking about the potential for, a basketball season, college basketball season later this year. And he talked about pods as well. So that's a great point and something we all need to consider as we go into this long weekend. Dr. Person, we did have a question about, trying to look for the right word, vaccines. So vaccine work. And can you describe a little bit about what you know about the work going on with vaccines, and then how does information or guidelines or even potential timelines flow from federal agencies like the CDC to Department of Health in Olympia and then down to the health district? Can you talk a little bit about vaccines?
Sure. There's a lot going on with vaccine development. Again, not just in the U.S., but across the world. And what they're doing a little differently now versus some of the earlier vaccine development is at the same time they are doing all of their necessary safety trials. Many of these companies are actually also producing vaccines. So they're gambling on the fact that if the vaccine passes the safety trials, passes the effectiveness trials, that they'd immediately be able to move into some distribution. We aren't going to see distribution for the entire world, I think, that this first go around. So there will be discussions around how do we prioritize that. There are already talks and meetings going on between CDC, State Department of Health, and local health departments about how will vaccine roll out when it's ready. Heather talked before about training and preparation. We do that not just for communicable disease or in this area for a radiologic emergency, but we also do it for things like how do you do mass distribution of medications or of vaccines. So that work is going on now so that when vaccine is available, we will be able to move it out into the community as quickly as possible. And again, this is where we don't just rely on what public health can do, but the training and all the prior discussions have also included hospitals, clinics, pharmacies, large employers, really all looking at where are places that these things can be done. You know, they aren't things that are going to happen overnight, but they're not things that we're going to have to sit down when the vaccine comes out and go, let's figure out a plan, because we're already working on that plan now and have been.
Yeah, no, that's great. That's, I think every time we talk about this, we learn a little bit more, but just to understand the journey really of the health district, and that, you know, having to rapidly gear up on staff and training and everything else, it's good to know that as vaccine work goes on, that you're planning for the distribution, and that you're working on that plan and how do we do it and everything else, so that we could look forward to when we do have a vaccine that, you know, you've got that plan in place. That's great. I have a general question. I've read about flu vaccines and the recommendation that, you know, we should all make sure we get a flu vaccine with the flu season coming on, and I'll just throw it out to whoever's the right person to answer it. Do you have some recommendation about flu vaccine coming up, and just along the lines of the behaviors we're trying to ask people to do with COVID? How does, you know, upcoming flu season, as the weather turns a little colder, how does that factor in? Who would be the best one to answer that?
I guess I can go ahead and take that. So getting vaccinated for flu is going to be critical, honestly, just as getting vaccinated for any of our vaccine preventable diseases. But you know, flu and COVID together, I think is the next, I'll say, bigger unknown that we're going to be looking to see what happens in the fall. So we don't know, these two viruses together, are they going to join forces, make each other stronger, or are they going to compete? So, you know, one will be the alpha virus. I think, you know, either of those could be a possibility. Protecting ourselves against the only thing we have a vaccine for right now between the two of them, influenza, is going to be so important. It's going to be important to make sure that our workforce isn't disabled by influenza in case it does have some harmful synergy with COVID. And I think on a very practical standpoint, we just need to look to reduce anything that's going to create, you know, fever and respiratory symptoms in the fall and winter, so that we're not trying to piece together, you know, is this COVID, is this flu, is this something else? So I think getting a flu shot is going to be something that we all want to add as one of our behaviors to help stop COVID.
That's great. Well, we're down to about 5 minutes, but I did have a question I wanted to throw back to Jason, and for some reason it just escaped me. Actually, oh, testing. That's it. Sorry. First, I didn't turn my mic on. Forget my questions. Testing. Jason, how's testing going? What are some sites, and what's the latest guidance from the health district on who should get a test, and you know, how should we approach that?
Well, our position has not changed over time. We feel that asymptomatic folks, in fact, anyone who feels like they should get a test, should go get a test. Okay. To answer your question, we do have capacity at our current drive-through testing site over at the HAPO Center. That's been working well. We do have additional capacity, so if folks feel like they may have been exposed or are not feeling well, or just, you know, want to get it done, we would encourage them to come on by and do that. And, you know, we're looking at other testing options going forward, potentially outside of the National Guard, and some additional testing sites. So we'll be looking to kind of anchor and adjust depending on what the demand may be, but we're encouraging folks to go get tested if they feel they should be.
That's awesome. Thank you. Well, let's go around the room. I just want to thank all of you for being on again, Dr. Person and Jason, you know, for being back with us again. This is great information. I think, as always, we have a good discussion, and we hope that it helps, you know, get these positive messages out. Our trends are going the right way. Heather, thanks for joining us. You've really added a lot to the conversation, and now I know what a CD supervisor does, and that's awesome, as well as our audience. But you guys want to make some closing remark, and maybe we'll start with Heather this time.
I think the most important thing I can say to the community is keep doing what you've been doing, because it is working. And the best thing you can do to help our businesses and our community open up is take this personal responsibility to do what needs to happen so that we can continue to improve. And we have the power and control to do that in our own individual lives, and that will help make us a stronger community.
For sure. Heather, thanks for joining us today. Jason, you want to add a closing remark?
Gosh, I don't know how I top that, Karl, with that statement that Heather just made. I'll add one other thing, maybe an incremental additive might be helpful. Let's remain vigilant over Labor Day. Let's not blow it. Let's not have our line go the other way. And we have the power to do it, as Heather said. And thanks for having us, Karl.
Well, thanks again for being on. And I'll probably blow us past 10 o'clock by telling the story, but an earlier guest that we had on, and I don't have my notes in front of me from his show, but he was from the Infectious Disease Institute in Seattle. And actually, I think we were all on a call with the governor before 4th of July, before he came to town. And he was on that call. And so we invited him to be on, and he had a great story to this point, right? Which is there's so many variables going into any infectious disease. How does it spread? How do you get it? What you should be vigilant for? That he made the analogy to the weather, like predicting the weather, this complex set of variables that it's very hard to predict the weather because so many variables involved. But he said the difference is that if you go outside in the weather and you put your umbrella up, you putting the umbrella up isn't going to change the weather. But if you go out in public and you wear a mask, you social distance, you wash your hands, you use sanitizers, you do all the recommendations that you guys have done a great job of putting the word out, you can have an effect on this complex equation. I think that's the message we're all trying to promote, is we all have an individual responsibility, and especially now with Labor Day weekend, we just need to maintain our vigilance, keep it up, we're doing the right thing, and go the right direction. With that, Dr. Person, do you have some closing remarks you'd like to leave us with before we get into the Labor Day weekend?
Sure. I think Heather and Jason, spoke our case very eloquently. So I just want to pivot a little bit and using your weather analogy to also say that we do understand that this has been, hugely frustrating, I think, for the community trying to navigate, how do we manage COVID, and, what are we being required to do? Because it is a little bit like the weather, you can make your best plans or your best predictions, and they don't always play out that way. But it's not ever because anyone is deliberately trying to mislead people or is deliberately, trying to cause anyone harm. So, we do want to acknowledge that people are frustrated, but we also want them to remember that every single person in the health district, and I'll say every single person in our community leadership and our business leaders as well, is really trying to do everything that's necessary to move our community forward, to keep our community resilient on all levels, not just infection, but economy, mental health, all of those. And I still encourage everyone in the community, if you want to hold our feet to the fire, you want to make sure that we're paying attention to everything we need to pay attention to, please do that, because we do welcome that input, as long as it's, provided with either with humor or with respect, because I think we all deserve that too.
Yeah, for sure. That's very well said. Well, Dr. Person, Jason, and Heather, thanks for joining us this morning. It's been a great discussion, as we said. We really appreciate your time and all the work that your whole teams have been on the front line. As you said, you're tired, but keep it up. You're doing a great job. We really appreciate it. We appreciate your time this morning. So thanks again for joining us. And we'll be back, not this Friday, but the following Friday with another Coffee with Karl. So thanks, everyone. Have a good morning.
Yeah, thanks, Karl.
Thank you.
You bet.